Hey guys, it's Debbie Seidel, Vicky Dental Practice Solutions, and today I have a special guest with me. His name is Dr. Peter Vanstrom. He originally comes to us from Santa Barbara. He is a dentist from Emory Dental School and pre-dental school went to UC Santa Barbara. He is also the course director at Hyacin, and he teaches everything you need to know about implants. So thank you for joining us. We're going to be talking about how you can amp up your dental implants this year in 2019. It all begins now. Dr. Vanstrom, I'm going to call you Dr. V. I think it's easier for our people watching to remember Dr. V. Welcome.
Perfect.
Thank you so much for joining us today.
Well, thanks. It's good to be here. It's good to see you again. Did you have a good holiday season?
I had a very relaxing holiday. How about you?
Good. I had shoulder surgery twice, though, during the season. So
That does not sound relaxing.
I had a very different holiday season, yes.
Well, you seem like you're up and at 'em today, early in the morning here on the West Coast. Dr. V is coming to us from Atlanta, Georgia. So he's been up a lot longer than me this morning. Let's jump right in. I want to ask you, should a GP place surgical implants? And more importantly can it be profitable? I mean, I talk to doctors all the time and I try to get doctors to have just a little baby goal. We'll start out with let's just try to do one a month. So talk about this with the GPs.
Well, yeah, I think it's important that GPs really look hard at learning, if they're not already qualified, to learn how to place simple, basic dental implants, because it can be extremely profitable. In my practice, it's been wonderful over the last 15 years to add that. I have a comprehensive care practice, like many of the folks listening to this, where I learned to do endodontics, and I've learned to do some periotherapy and some minor perio surgery, and I just added dental implants to that with all the education. So I think what's important is that the GP get the educational training that they need, and certainly they can get into implant placement. In fact, if I could introduce them to a couple ideas for education, some ideas they might want to look into for pursuing some help in getting started in dental implants, would that be helpful?
Absolutely. Help us out with this.
Well, first of all, there's two organizations: the American Academy of Implant Dentistry, which has the AAID Maxi course, which is one of the best courses offered in the country. That course takes you through a year-long continuum where you learn anatomy, physiology, bone morphology, lots of hands-on. It's a very thorough, comprehensive course. There's the International Congress of Oral Implantologists that offers lots of courses as well. I'm a fellow of that academy, and it's a wonderful resource. But the dental companies themselves have come a long way in their educational programs, and if you affiliate yourself with a dental company, you can get an awful lot of education that's very useful at a very low cost. For example, with Hyacin, where I'm the course director in Georgia, we offer a basic course that's a 5, 6, 7, now it's an 8-day course now. And that course takes you through all of the didactics, all of the anatomy, morphology, and then it takes you right into actually placing on pig jaws and practicing, and then we go right into supervised surgery with patients. So there's a lot out there for education that I hope the GPs start to look at, and go through your dental implant companies first and go from there, and you can get some great education and learn how to place implants.
Well, that is a great place to start. I really appreciate that. I am running into a lot of young dentists. We call them, some of my colleagues call them, I don't know if this is an insult to them, but they call them baby dentists. So we're working with a lot of young, they're just 30 years old. And do you ever find that some of the dental schools are actually teaching implant placement to a general, just in general?
I'm seeing more. What I'm hearing from my students that I teach, there already are practicing dentists. They got some extra training more in their GPR programs, their 1 or 2 year postgraduate programs. The undergraduate program exposed them to implants more on the restorative side, and not much on as much on the surgical side. So I think it's still limited in the dental school. There's always going to be that battle. It's interesting when we're talking to general dentists, the periodontists and the oral surgeons are very protective over the implant realm because it's very profitable. And in the dental schools, those specialists want to keep that in the specialist realm. So they're not as generous in the dental schools yet in teaching GPs.
I see. Very interesting. So what I'm going to do is I'm going to post a link to this course that these doctors, we have a lot of young doctors that are probably going to be watching this. And I want to invite them to meet you. And I'm going to be there with you teaching them how to, I don't like to say sell, I want to say serve. I want to teach their hygienists how to serve the patients best. And that's what I have a passion for. But can you share with us, how has your team been able to serve more implants to your patients? Can you address that with us?
Yeah, that's a good question. And I mean, I've been practicing for 30 years now, and I've been in dental implants on the surgical and restorative side for 15 years, surgical for 15 years, restorative, of course, the whole time. And my team has been with me. A lot of my team members have been with me about 20 years as well. So they're really good at what they do. I'm very lucky. I have a very good team. And one of the things that's so important with dental implants is to really show a lot of confidence all around the office when you're talking about dental implant surgery and dental implant placement. Patients really are a little bit nervous when they talk about dental implants. It's actually surgery, and it's actually it's surprising how they get so worked up about putting a little screw in their jaw. So we have to be what I coined a term, compassionate confidence. And it really works well when you talk about implant dentistry to your patients. You have to be confident. You have to know that you are trained and you can place this implant perfectly and that it's going to result in a lasting situation for the patient. And you're going to put a beautiful crown on that implant for them. Or you're going to place 2 implants on a lower jaw and you're going to snap a denture into that. And it's going to fit real comfortably and securely. You have to have that confidence, so you have to have your education and training. But you also have to be compassionate with these patients. The one thing I've learned is a patient loses a tooth, and it's really it's something that we dentists take lightly sometimes. And it's a big deal to these patients. They've lost a tooth or they've lost all their teeth, and they feel like they really want something to replace that. And they want to put their confidence in you to get their teeth back into function. And so if you're confident and you're showing them compassion and understanding that it does cost money, implant dentistry is very expensive. It goes outside of the realm of insurance even. And so we have to really work hard on our side in the dental office. The team has to be on top of the fees, and they have to understand all of the financial partners that you might offer for financial arrangements in your practice. Those are the kinds of things, Debbie, I know you help the patients, you help your clients an awful lot with, is how to handle the finances. Is that correct?
Absolutely, yes. Yes, and the most important thing is to, in the back office, get your patients to want what they need. And I think I believe that patients spend a lot of time throughout the year with the hygienist, more so than any other clinician in the office. So I'm very passionate about teaching the hygienist what to say so that they can actually create a collaboration with the patient. And the patient is actually thinking of the answers. They're thinking of what they want. It's just the hygienist kind of guiding the conversation.
Well, and you know what? It's interesting when you say what they want, because they have to want that dental implant.
They do.
They have to want the 4 on the floor replacing their broken down teeth so that they can have a full new denture, replacing screw retained denture for new teeth. They have to want that. And you'll find in implant dentistry that I think more so than any other part of dentistry, the rewarding part is they do come to you because they do want those solutions. So you're kind of ahead of the game sometimes when it comes to the patients come in really thinking, I know I need a solution, and you just have to be ready to present that solution for them. And so implant dentistry is a lot of fun in that regard.
what's really exciting to me is that patients will come in and they're saying, I don't know the patients. I'm coming in there as a coach. Sometimes I'll work a few days. Well, I do work a few days a year as a hygienist clinically. And either I'm there as their coach or I'm there as a clinician. And I hear it all the time where patients are saying, I know that I need this and I can't afford it. But if we can let them know that we heard that, but also find out why they're saying they can't afford it.
Right.
Because there is a way, if you listen closely, you can walk through that appointment with the patient. You're the hygienist walking them by their side as you're working with them on their teeth. By the end of the appointment, when the doctor comes in to do the exam, many times I see it where, because you've stayed with them where they're at and you help them, even patients will say, I'm on a fixed income. And they will, at the end, when the hygienist has shown them what it looks like in their mouth, how the teeth are tipping over, top of the teeth might be falling down, is what they're words that the hygienist needs to say. So it starts to click in their brain. It's a lot of brain science.
Yeah. And you even hit the nail on the head. It's compassion for knowing that maybe they have some financial difficulties, and you have to work through that with them. You have to really create that desire so that they'll step past that financial obstacle. And it's very implant dentistry. Again, you have a patient who is losing the ability to chew food and the ability to take advantage of the nutritions of food because they can't chew, they can't masticate. And we offer a solution for that. So it's a wonderful realm in dentistry. I'll tell you, I'd love to take it back if I could for just a second.
Oh, please do.
To maybe helping the dentist who's there. I think one of the concerns is, where can I find these dental implants in my practice? How can I be producing enough and find enough? You hit a very simple number. Let's try and do one a month. Let me show the audience if I think most dentists can do 4 dental implants a month in their practice. If they just need to shake the dental tree. They need to shake the tree, and they need to do 2 things. They need to really take charge of their emergency cases, and they need to learn how to handle extractions and socket preservation. It's funny, we tend to jump ahead right into implant dentistry, but if the general practitioner learns how to extract teeth gently, preserve the bony walls, enhance the bone so that they can come back in 3 months and place an implant, they control the case. And I think that's an important thing for all GPs to think about. So we want to learn how to take teeth out gently, keep it in the practice. Also, you want to shake the tree, and you want to find in your practice, where are all the periodontally involved teeth that are in your practice that may need to be extracted? Did you have fractured teeth come in that are non-restorable? Do you have denture patients, partial patients? All of those are in your practice, and you need to go ahead and start finding those, tracking those, and preparing your team to talk to those patients about when that periodontally involved tooth fails. What are the options for replacing that? And that ties into your hygienist very well, because that's the conversation the hygienist needs to be having with the patients.
So, Dr. V, as we are reviewing client metrics, one of the things, what you were talking about is so true. And I think that doctors don't realize the patient comes in for a limited exam, and it's very important that the doctor knows what has been discussed with the patient. Have they even been offered a more comprehensive exam? Because I see that one of the inefficiencies that I work to flip to being proficient is limited exams. Patients come in and they do nothing. There are many patients who know they need to have the tooth extracted, and they do nothing because they can't even afford that. So let's transition help these doctors understand how their team can help the patients to have the extraction, and then they need to have the graft and the bone, the membrane, and let's talk about that a little bit more.
Well, I think that's great, and I think one of the things that you're very aware of that you share with your clients is we have to figure out what motivates those patients too while we're talking to them. We have to know, are we talking to a patient who is aesthetically driven? And that patient is a conversation where we're talking about they may have a holy smile with that missing tooth. It may be a first bicuspid. A very common tooth that ends up missing as we age is a first bicuspid. It's a very weak concrescent root, and it's lost quite often. Now, for an aesthetic person, the conversation is, how do you feel about your smile? And let the patient answer the question. One of the things teens always do, and hygienists especially, because they're just nice, amiable teachers who want to help, and they always talk too much. So if you just ask the patient those questions and let the patient answer. How do you feel about your smile? I notice there's a hole when you smile. Does that bother you? Then let the patient talk about it. And the patient starts to tell you that it's a concern that they do indeed have, and now they're more willing to talk about that implant for a solution. The same thing works for future cost. If you have a person who is very, very set on cost, and that's their motivator, well, then talk about how much it's going to cost later as they let that tooth go and another tooth shifts and the other tooth falls over into the space. And now you're losing the tooth above it. You're losing the tooth next to it. Your function is less. And now it's going to cost you so much more money down the road to replace what was one $3,900 replacement may turn into a $27,000 replacement of all your teeth. So future cost is a wonderful thing to talk about patients as well.
Can you address the compassionate confidence? You coined this phrase. So I know patients are afraid of how much, like they'll say, oh, it's going to be at least $8,000, isn't it? So can you give us some tips on compassionate confidence? What do we say and do for that?
Well, I think one of the biggest things I could help a practice with, and that I know you help practices with, is how do you talk to your patients about fees to begin with? And I was taught very early on by some great mentors that when you're in the realm of implant dentistry, it's a more expensive area. And I'm a firm believer that the entire team, including the dentist, have to be aware of the fees, and they have to confidently look the patient in the eye and address those fees pretty early on. One of the mistakes I made when I was younger in implant dentistry was I would go through the whole treatment plan conversation. I would go through everything we could do for the patient, not really honing in on their concerns and their questions. And then I would never discuss the fee until very late in the conversation. I have found in the more expensive realm of dentistry, it's better to get the fee conversation out there. Let's not be embarrassed about the fact that it costs some money to replace a tooth that isn't there anymore, because we're compassionately confident that we can do that for the patient. So, for example, I would love to see your clients think about a one fee conversation for dental implants. In my practice, my entire team knows if it's a single implant, an abutment, and a crown, it's $39.95.
Oh,
that's it. So there's not hemming and hawing. There's not trying to pull up all the figures. We know the fee. If we're going to do grafting and socket preservation and the implant, it's $44.50. So the whole team knows. If it's two implants that we're placing and then we're going to snap a denture in and we're creating a new denture for snap-on, we know it's $8,000 right off the top. So this is something that I know you can help these dentists with, and I can help them with, is setting those fees that are comfortable, that everyone's confident about. And then you can very easily look the patient in the eye and go, that's around $8,000 to replace all those lower teeth with a denture that snaps into implants. But it'll be stable and you'll be able to chew your food again. Wouldn't that be wonderful, Harvey? Let Harvey answer that.
I love what you're saying, because it is being compassionate with the patient. Now, you were talking about the front office, so it's the back office that we've been talking about this far. And the back office needs to get this all set up. Now, they're still going to freak out when they hear 8,000 or 3,900. But I would like to say that we need to also ask them, how would that change your life if we can help you get this paid for? And
very good.
I think it's important for the back team to build up the person up at the front who's going to talk about the payment arrangements, and let those patients know confidently that you have an expert in your office who can offer flexible financial arrangements.
Yeah, and I love what you just said, because when you said, how would it make you feel? How would this impact your life? To ask that question, you're bringing out the emotion, and that's what sells. It's the emotion. It's realizing that, hey, this is going to make me a happier person. And I think that's beautiful. That's probably the best thing that we just shared the whole conversation with these.
Thanks, Dr. B. So I wanted to ask you a few more questions. Now you're lecturing on it's guided implant surgery. And I love that you get to work on the pig's jaw. But how is implant guided surgery benefiting the GP? And by the way, part B of that question, I just discovered here in Oregon, the Oregon Board of Dentistry does not allow the doctors to do all on four. Is it all on four?
Yep.
Yeah. Okay. So can you address these two?
That's interesting. So in Oregon, they're now only board certified oral surgeon and periodontist are placing for all on four.
Yes.
And I will share with you. I think this ties in really well to our conversation about basic implant dentistry for the GP. That's a big leap to go from placing a basic implant to doing osseous reduction and placing 4 implants and immediately loading those implants. I think that's a quantum leap, and I'm glad to see there's some checks and balances along the way for that. I don't quite agree that there aren't general practitioners who aren't qualified, because I know a lot of GPs who do a great job with all on fours, but it is a much more difficult procedure. So I think it just brings into the conversation, let's focus on the basic. Let's get the GP doing the one and the single implants, the couple of multiple implants, and the implants that snap down dentures, and that's highly profitable right there. Have a great relationship with an oral surgeon and work with them on those highly complex cases. There's nothing wrong with that. I think it's wonderful, as a matter of fact. So I'm not opposed to that at all. But I do think when we talk about guided, it's interesting. I am a huge proponent of guided surgery. I want to correct one thing, though. I lecture on basic surgery first, and basic surgery is not guided because we want our GPs to be able to place a dental implant without any guides and know all the concepts and all the rules, all the bone morphology and everything involved. Because if you go to guided, there are times when you have to take the guide off and make some decisions and angulation corrections and things freehanded. So we want our dentists to be freehanded first. So that's real important. And I think every dentist needs to learn to place implants without a guide first. Oh, just in case you get into a situation. Okay, does that make sense?
It does, yes.
Yeah. So that's important. But when we get into guided, I think guided is where most GPs should be. And I think the one thing they fail to understand is the time savings. When you use guides for surgery, you don't have to do any flaps. You don't have to do any post-op suturing. You don't have post-op visits to uncover any of the implant. You put a healing cap on there. You eliminate a number of post-op visits, and the patient is absolutely blown away by how fast and efficient that surgery went for them. And they become disciples of your practice. And the difference of you taking the time to flap their tissue and finding the bone, analyzing the bone, placing your implant, free-handed, suturing it all up, all of that's involved, even with a single implant. If you have a guide and you just follow that guide that you've already created on the CBCT and you've merged with your scan of the dentition and you've got a perfectly set guide, it takes you maybe 3 to 4 minutes to do the surgery. So the patients are really impressed. And then guided for parallelism for 4 or 2 implants for a snap-on denture, you can't beat that because it's the precision. You place those implants exactly where they need to be, parallel with one another. So I'm a huge proponent of guided. I think it's something that dentists need to think about. They get upset. They say, well, how do I make the money for the guide? Because it cost me $150 for the guide. Well, actually, the time savings is where it is. The time savings is the cost savings. And the patient who's going to go and be your disciple and talk about your dental implant practice, and the fact that they didn't have stitches, they didn't have any long post-op appointments or complications, and everything went so quickly. So I think it's guided something that every dentist should be looking at, that does every GP that's in implant dentistry.
Thank you so much for that information. When I first learned about implants, it might be 30 years ago, I hate to say, but I went and observed an oral surgeon, and we were there for hours. And boy, oh boy, times have really changed. It's just phenomenal. And that's exciting to let our patients know. And it's hard for them to believe. When I've had chances to have the conversations with patients, it's hard for them to wrap their head around only taking 3 or 4 minutes to do the implant.
Well, and they also, the other thing they appreciate is the technology side of that. You know, patients love technology because they know you're on the cutting edge. And if you're showing them that I'm taking this CT scan, I'm merging it with this digital recording of your teeth, and I'm going to virtually place this implant, they're going to make a guide. It's going to go right where I wanted it to go. That's the confidence there. That's the confidence. You're confident because you know it's going to go perfectly, and the patient's confident because they're seeing technology that's showing them that you are on the cutting edge. So I think it's very, very beneficial.
Great. So I want to ask you about implant maintenance. Tell us about what you recommend for that. I mean, I was in an office just for the day during the holidays. I worked a few days as a clinician, and it was very fun and exciting. And it was great to see what's out there. And I was surprised that one of the offices where I was, the implant patient was only coming in to see the hygienist every 6 months. I was taught differently than that. What do you recommend?
Well, and I think it's an area that we have neglected looking at as thoroughly as we should. And I think it's great that you're bringing this up because maintenance of that implant is so important. The patient just spent upwards of $4,000 for one new tooth. We can't take that lightly. Again, we have to be compassionate, and we have to show the patient that we care about the future of that implant as well. And part of that is perhaps more frequent visits to make sure that they understand completely how to care for that implant. And we monitor that while we're changing. You know, the hardest thing, you work a lot with hygienists and patients. The hardest thing is behavior modification, correct?
Correct.
Well, now here's a patient who may have lost that tooth because of periodontal problems. Maybe they lost all their teeth, a number of teeth because of periodontal problems, and we've replaced them with several implants. How can we expect that patient without a lot of help to change their habits and take care of their implants? Because we're seeing that if implants aren't cared for properly, with proper maintenance and with proper home care, they will fail as well. They're not the panacea that we thought they were 20 years ago. They just put the metal in and everything's fine. They can't get gum disease. They can't get cavities. They're never going to be a problem. They have to be maintained properly. So I have a protocol in my office where the patients first receive their implants. They're on a 3-month care for an extended period of time to make sure that we know they're taking care of it properly. And we educate them each visit and review with them the protocol and are they doing the right things. And we assign specific home care products to our patients. We work hard with Curaprox, which is a Swiss company that gives a lot of really amazing, intricate interproximal brushes and very soft bristled multi-tusk brushes that work well for implants. I work with Denmat, and I'm a firm believer in the Rotodent because it picks up the medicaments, and we love to be able to apply chlorhexidines and fluorides and all the medicaments that are necessary to maintain these as well at home. And we train them, and we have the reviews when they come in. So we charge for those products so that we can afford to educate those patients. We charge for those, and that's something that I know you help offices with a lot, and that I love to help offices with is how to be profitable while taking care of these patients' hygiene needs, including implant dentistry.
Absolutely. I think it's very valuable, and studies have shown that 70% of your patients will never use the product unless you have it available there. And maybe you're charging a few dollars more for that patient to get the Rotodent, to get the, whatever, the Curaprox. But you're teaching them how much, like the fluoride gel, if they're high risk for caries, it's just a little pea size, and it takes it doesn't take much time to use it. And it's
Right.
showing the patient and having the patient use it there. That's self-efficacy. Again, it's that confidence that you talk about. It's communicating with the patient so the patient feels confident and knows that they can go and do this.
Yeah, and it's just simply reminding the patient that you care about the implants you place. Plus, how about you care about the teeth that are remaining so they don't have to have another implant? That's a
Good point.
huge conversation. Huge
Very
conversation.
good point. I like to tell the patient, what I've seen as going back to my years as a clinician, I saw the majority of patients who did lose an implant. It was because they had so much plaque around that implant. They never took care of the implant. And that's why I saw the implant. They lost the implant because of that.
Right.
So
right.
when patients understand that.
Yeah, we're seeing, I mean, retained cement still is the one cause of peri-implantitis that's the most frequent problem. Is an implant is placed with cement on the abutment, and the cement's not cleaned out properly, and they end up having lots of problems with lots of bone loss. Now that's still the highest frequency problem, but we are seeing patients who they have the implants placed and they just simply disappear, and that's not the answer because the plaque will build up and we'll start seeing threads that are showing, and as threads start showing, it's harder and harder and harder to maintain those implants.
Okay.
So we definitely need to be on top of our healthcare, our periodontal care for the implant patient.
Yes, as we start teaching these courses together, I know you and I have talked about a goal to get the hygienists more involved, so I can work with the hygienists. Now, in investigating this and preparing to do this in 2019, I love Hugh Freedy. I went to USC and they're pro Hugh Freedy instruments. Mm-hmm. They have really come a long way with hygienists maintaining implants. It's just phenomenal. And they've actually offered to give us what we need so that the hygienists can learn to do implant maintenance hands-on while you're working with the doctors. So something to think about for our viewers in the future.
Oh yeah. And I think they need to be a lot more confident. The hygienists need to understand the biggest change in research in hygiene care of dental implants is we place implants with roughened surfaces. So no longer are the hygienists, they don't need to be that afraid to scale the implant, to clean the implant, to get down under that crown. The days of plastic scalers are well behind us. That was, the old machined implants where we wanted to maintain surface and have surface as smooth as possible. Well, we're using roughened implants now. So I think hygienists can be very, very comfortable in knowing that they can be a lot more aggressive. I hate to use the term aggressive because I'm not implying that they go in there and just go wild, but we want to clean those implants. We want to get the plaque off at whatever the cost, because it's more important to get those implants clean if there's a couple threads showing than to be leaving anything behind. So I think it's great. I think it's great that we're going to be in a position to really get that message out.
Yes, absolutely. And the other thing that a lot of people do not know, clinicians doctors who are watching this, and maybe there's some office managers watching, that we have CDT codes. So, when you are cleaning around the implant in the hygiene appointment, that is billed separately. So there is a reimbursement for that. Yeah. So, and
I think that's where you're going to help out those offices so much, because it's a whole nother area that's so hard to keep up with. And in fact, you're on top of that. That's terrific.
Well, Dr. V, thank you very much for your time. I know you're very busy and you're getting ready to jump on a plane here, but I really appreciate you taking some time with us today. And I hope that you'll join us again in the very near future.
Well, it's been terrific, and I hope everybody comes and sees our new course we're putting together on implants and implant care and implant profitability.
Yes, it's in Atlanta, Georgia on the 26th. It's all day, and it's going to be a lot of fun. I know when you're up there on stage, people love you. You're like E.F. Hutton. They don't just listen, but they they want to still engage with you when you're up there, and I'm going to be there with you.
We'll have fun. Thanks a lot, and have a great New Year. So far, it's going pretty well.
Yep, first day back to the office, and it's going well. You're kick-starting our year, Dr. B. Just stay right here. Don't go anywhere. I'm going to end this, but then I'll get back in the green room with you. Thank you guys for joining us, and Happy New Year. Let's make it a great year.
Happy New Year.
Yeah, we're going to amp up your implants in 2019. That's our phrase. Bye-bye.